Hello everyone, welcome back to my YouTube channel, and today I'll be talking about a most sought topic about painful menses or painful cramps, what we medically refer to it as dysmenorrhea. As I started by saying, dysmenorrhea is the medical term for painful menses, or rather the painful periods. Allow me to say that dysmenorrhea is classified into two. We have the primary dysmenorrhea and we have the secondary dysmenorrhea. The primary dysmenorrhea, this is where female experiences too much pain, but they do not have any pathology, or in other words, they do not have any problem with their reproductive health. But when we talk of secondary dysmenorrhea, this is where a woman experiences too much pain during their menses and they are caused by a certain problem in their reproductive health system. Allow me to say that both the primary and the secondary, they have the things that we refer to as the risky factors. The risky factors are the things that are likely to make you suffer either this primary or the secondary. We have several risky factors that are associated with the primary, they being number one, to people who experienced their menses very early, maybe at the age of 12 years, the people who have heavy or prolonged menses. We also have smoking and obesity, and where there is a family history of these dysmenorrhea. But we also have the risk factors that are associated with the secondary dysmenorrhea. And we say that in every secondary dysmenorrhea, then this means that you have a problem that needs to be addressed. In the moment that problem is addressed, then your issue of experiencing this too much pain when you are menstruating, it's cleared. Allow me to say that on the risky factors that can predispose someone into getting these secondary dysmenorrhea are the reproductive health problems that can either be affecting the uterus, that can either be affecting the fallopian tubes, the ovaries, all the reproductive health, that's all. So some of these problems, we have things like the fibroids, we have things like pelvic inflammatory disease. I talked about it in a certain video. We have endometriosis that I also did a video about it. We have ovarian torsion, and we also have a condition that we refer to as the tubal ovarian abscess. So if you have any of these problems and maybe many more, then you are a candidate of experiencing very painful periods. When we talk of the symptoms or how you can tell maybe whether yours is a primary or whether yours is secondary, we have the symptoms that the moment you notice them, you can easily tell maybe your painful period is as a result of a problem in your reproductive health, or you can tell maybe your painful period is as a result of many other things that do not cause any harm to your health. So when we talk of the primary, dysmenorrhea symptoms, we have these are the people who experiences a lot of cramps in between 48 to 72 hours, maybe before they get their periods or immediately they get their periods. So maybe someone starts experiencing your cramps today for like 2 to 3 days. Then after that, you start getting your menses. There are also other people who doesn't experience any pain when they are receiving their periods, but they suffer these painful cramps after their menstruation is over. That one is one sign that you suffer a primary dysmenorrhea. And this, we have also people who have suffer constant low abdominal pains that mostly radiates either to the back or to the thigh. What we mean by radiating is you feel a lot of pain in your lower abdomen, and then you feel it's like that pain, it's migrating to your back, and it's also migrating to your lower thighs. That one is also another sign that you suffer a primary dysmenorrhea. We also have another symptom that these people under primary dysmenorrhea, they suffer cramps like all the pain of labor pains. The labor pains, maybe to the ones who have given birth, you already know that labor pains are lambe sharp and they appear on and off with very painful episodes. So if maybe we are experiencing painful episodes that comes and goes, and then that one tells that you also belong to a group of people who have primary dysmenorrhea. But now, when we talk of secondary dysmenorrhea, remember we started by saying that secondary dysmenorrhea, they do not just occur, they occur when you have a problem with your reproductive health. So the clinical features that can tell us that your period, maybe it's due to certain abnormality, it may be when from the age when you started getting your periods, you have never experienced any pain. But when you are in your 20s or in your 30s, that's now when the pain is starting to come up. Another symptom is whereby you have irregular bleeding. What we mean by irregular bleeding, it's maybe this month you get your menses, then next month there is no menses. Or maybe on the very first days of your bleeding, the bleeding is too little. Maybe on the third day, when the bleeding is supposed to go down, that's when you are bleeding a lot. Irregular bleeding, it's also the people who experiences menstruation, but they notice is some clots in it. That one is also an irregular bleeding. So anytime that maybe you experience there is a change in bleeding patterns, then that one tells us that you have a problem that also needs to be treated. We also have issues with the infertility. So these are the people you are experiencing your periods very well. Maybe like every month you are getting your periods, but you have tried several times to get pregnant and there is no success. Then that one also tells us that you have a problem that needs to be addressed. Another group of people is maybe people who experience painful sexual intercourse. And in most cases, this can happen like days before you menstruate or immediately after your menstruation, or maybe even if it happens to have sex still in your menstruation, there is a lot of pain. But when you are far away from your menstruation or you are far away towards your menstruation and you engage in sexual intercourse, there is no pain. So this can happen in two patterns. Maybe you get your period, you get to experience painful sex days before your periods, or even days after your periods, or throughout you experiencing painful sexual intercourse, then that one also tells us that you have a problem. Another thing is people who experience vaginal discharge amidst their bleeding. There are a group of people that you have heard them saying that while they are on their menses, immediately after their menses, they start getting a discharge that is somehow whitish discharge with the particles. So after you are done with your bleeding, vaginal discharge starts. Or maybe before you start your menstruation, you start experiencing there is a lot of whitish discharge coming out from there. Then that one also tells us that you have a reproductive health problem that needs to be addressed. Another issue is the people who experience poor response to NSAIDs. When we talk of NSAIDs, it's things like the Brufen, things like meloxicam, and some other people also use Buscopan. So when you're experiencing this pain, no matter which painkiller you take, all this pain does not go away. So that one also tells us that you have a problem that needs to be checked and treated. So in all these, when a person comes to us with the problems of these painful periods, first of all that we need to do to know whether you belong to primary or secondary, first of all we have to take a very good history from your side. You tell us at what age you started getting your periods, whether you smoke, we'll automatically see whether you are obese or you're not, and you will also ask you whether you have ever experienced of any history in one of your family members claiming that they suffer all this pain. So if there is nothing like that, then we go ahead into examining you. Above the text that we do, we will also have to do pelvic ultrasounds. We can do what we refer to as the transvaginal ultrasound. If maybe someone presented with infertility, and when we ask about their their menstrual history, they start telling you that their menses is too painful, Honda for a form of an X-ray that we refer to as HSG. The purpose of all these HSG is to check whether you have the blocked fallopian tubes or you do not. But in most of the times in primary dysmenorrhea, we just manage it with NSAIDs. But now when you have this secondary dysmenorrhea, we manage you according to the cause. So that's all about the painful periods. If this video has helped you, kindly don't forget to like, don't forget to comment and share, and also don't forget to subscribe. Until we do another video, I sign out.